So thanks again for joining today. This is a very special webinar in honor of Canadian Patient Safety Week. It's being co-hosted by the Institute for Safe Medication Practices Canada, Canada's Drug Agency, Canadian Medication Appropriateness and Deprescribing Network, deprescribing.org, and we're really glad to have you join us for this talk about safer medications and about 5 questions to ask about your medications tool, which we hope is going to help people to be more confident in conversations with their healthcare professionals. And I'll just introduce myself. We can go to there we go. Actually, I have control, so I'm good. So hi, everyone. I'm Emily McDonald. I'm an associate professor of medicine at McGill University Health Center. I'm a specialist in internal medicine, and I'm the director of one of the organizations that's leading the webinar today. So I lead the Canadian Medication Appropriateness and Deprescribing Network. My interest in research and in looking after patients is safety. So I really try to focus on how to make healthcare safer for patients. And this includes reducing risks for medications, preventing mistakes, helping patients and healthcare providers talk together and work together to make really informed decisions. I'm really glad that you joined us for this medication safety talk in honor of Canadian Patient Safety Week. We're going to explore some questions that you can ask about your multiple medications and discuss some really practical ways to have conversations with your healthcare providers. And we really hope that you find this session informative and empowering. I'm going to start with a land acknowledgement. We do give land acknowledgements because it's the responsibility of all people in Canada to understand our history and recognize that we've had a role in colonialism in the past and that that's ongoing. And a land acknowledgement is a small but meaningful step towards reconciliation. So personally, I'm speaking to you today from the city of Montreal, which is known as Tiohtià:ke in the CADeN-ReCAD language and is Mooniyang in the Anishinaabe-Moan language. And the CADeN-ReCAD Nation is recognized as custodians of the land and waters where I live and work. And there are other speakers on this webinar, and they come from diverse communities. And one action that we could all take together is to learn a bit more about some of the traditional healing practices and medicines of the Indigenous people. And this could help us, face some prejudice and racism, and it supports culturally safe and more comprehensive conversations about healthcare. So that's why on this slide, you can see 4 sacred medicines that are used by Indigenous communities. So tobacco, sweetgrass, cedar, and sage. So our plan for today is to explore why taking multiple medications might have risks. Of course, it also can have benefits. So we're going to try and, show you a really balanced view of that. I think one of the most interesting things about our webinar today is you'll get to meet Laurent, who is a real patient and person with his own story. And he experienced side effects of medications, and he took some really important action to solve those issues. And I find his story really inspiring. And also he helps give us some practical tips, and he does a really great job of explaining it in a way that's easy to understand. So we also hope that people are going to learn what to ask their healthcare provider, how to have that conversation about risks and benefits of taking multiple medications. And then we're going to give you access to a tool which is freely available to help start that conversation with your healthcare provider. So we would love to hear from you today before we get started with 3 short questions. So that's going to pop up on the screen. It's a poll. And in the poll, you're going to be asked, do you or someone you know take multiple medications? You can define that as you want, but we often say that's 5 or more medications. And then, whether or not you agree about how informed you are about taking multiple medications. And have you ever asked a healthcare professional if you could stop or lower one of your medications? Because we're just really curious to know what you all think about that and your experiences. And then for the 3rd question, you just need to scroll down to answer it. And you can click on your screen. And if you can't answer, it's not a problem. Don't worry about it. Because not everyone has the technical ability to answer. And absolutely, vitamins can be included and supplements. We include what we call over-the-counter medications in that list. So for sure, yeah, if that's part of your number of meds, you can include that. Here we go. Okay. So here we go. Do you or someone you know take multiple medications? A huge 95% of people said yes. A few people said they don't know, which is totally understandable because it is kind of a complicated question. To what extent do you agree with the following? So, some people feel that they're well informed, maybe about a quarter of participants, and a few more feel that they do have some understanding of the risks of taking multiple medications. Some people are kind of neutral about it, and then we have about 10% of people, or even 15% of people, who really don't agree that they're well informed on taking multiple medications. And that's exciting. So about two-thirds of people in the panel have asked their healthcare professional if they could stop or lower one of their medications. So clearly an interest amongst people who take multiple medications in reducing or stopping medications, if it's safe to do so. All right. So I'm going to introduce to you our first speaker. So that's Jonathan Lamb. Before we dive into the content, he's going to introduce from Canada's Drug Agency their perspective. So he's the director of the appropriate use at Canada's Drug Agency. He has over 10 years of experience working on complex healthcare challenges, and he's led a number of initiatives to improve how medications are prescribed and used, both at the provider level and across the healthcare system. And Jonathan would really like to share a few words about how the organization works to make medication use safer in Canada. So I'm going to hand things over to you now, John.
Perfect. Thank you, Emily. And there you go. I'm able to advance my slides. So like Emily said, first, thank you for everyone for taking time to join us today. I know it's always a busy time, so appreciate you being here. And maybe be remiss to say that if people are staying up late to watch Jays game, go Jays go. I'm a bandwagon fan. So first, thank you again to Canadian Medication Appropriateness and Deprescribing Network for putting this webinar together on an important topic about the potential risk of taking multiple medications and tools that can help patients talk to healthcare providers about this, improving appropriate use of prescription medications, and ultimately health outcomes is an important area of focus at Canada's Drug Agency. So just a little bit about us and who we are. So Canada's Drug Agency is an independent, not-for-profit organization. We're funded and created by the federal, provincial, and territorial governments and led by a 13 board member. Some of the work that we do and the key work that we do is providing credible and objective evidence and advice to health system leaders about drugs, health systems, and technologies by answering questions like how effective is a new medication compared to other treatments? Should a new product be reimbursed by public payers? And which patients benefit most from a particular treatment? We also provide evidence and products to support patients and clinicians to help with appropriate use. So when I say appropriate use, what do I mean? And Emily talked a little bit about this in terms of safety, but really appropriate use is when patients, caregivers, and healthcare professionals work together to choose safe and effective medications most suited for that person's needs and goals to achieve the best health outcomes. So really using medications appropriately is growing more and more important as the Canadian population ages and medication use becomes more common and also more complex. So what are we at Canada's Drug Agency doing around appropriate use? We have developed a 5-year appropriate use strategy, a pan-Canadian strategy that will guide our work around this area. And some of the goals that we're doing is within our appropriate use strategy is supporting patients and clinicians with resources and tools so that you are able to make the best decisions possible about your medication use. There are many excellent organizations. Some of them are here today, like CADeN, ISMP Canada, and others doing this work. So we're also looking to really collaborate with these partners to make appropriate use better and for a stronger impact through working together. So today we're very excited to share an example of this work with you that Canada's Drug Agency, the Institute for Safe Medication Practices Canada, and Deprescribing.org in building a tool to support your polypharmacy or taking multiple medications and how patients and healthcare providers can really have conversations about this. So thank you again to the Canadian Appropriateness Deprescribing and Canadian Medication Appropriateness and Deprescribing Network for hosting this event with us. And I'm looking forward to hearing speakers talk about their real life stories, talk about the risks of taking multiple medications and benefits and why it matters, and tools that can support your dialogue with your healthcare providers. Thank you.
Thanks, John. So, we have a bunch of really high-level national organizations that have recognized that medications are really helpful, but that also that they can have side effects. And it's really great that Canada and our different safety organizations have recognized that this is an issue that needs attention. But I think, really a person's story is going to bring home this issue better than anything that we present today. So I'm really happy to welcome Laurent. He's a patient who has lived experience with taking multiple medications, who had side effects, and he led an active role to change his medications and improve his care. And his story is really going to help us to understand the big efforts that we need to connect people with their healthcare providers and help them to have this conversation. So I'm really pleased to introduce Laurent, who will be sharing his experience. He's 46, lives outdoors, loves outdoors, doesn't live outdoors, and loves combat sports. And he's lived with chronic pain since a very important spinal cord injury in 2010. He's a longtime facilitator of support groups with the Quebec Association of Chronic Pain and a patient partner with the Quebec Pain Research Network. And he participates in research projects. And he's helped with initiatives like the North American Pain School, Mal Invisible, Savoir Media, and has contributed to media initiatives to help others living with pain. So Laurent was taking multiple medications to manage his chronic pain, and he's here to share his journey and how he learned to navigate the challenges of living with them and regain control of his health. So welcome, Laurent.
Good morning, everybody. My name is Laurent Dupuis. As I've been introduced, I was involved in many different sports from a very young age. Doing so, I sustained my fair share of injuries, had to go through surgeries a few times as well. And through all that process, I had to learn how to manage pain on a daily basis. At the age of 31, playing around with the kids around a little park, I went down a water slide, not knowing at the time that the water level was normally very, very low. I had simply hit the bottom of the lake with my head. Doing so, I shattered my fifth cervical and gave me also a spinal cord injury, which left me paralyzed neck down at the time. Being more concerned about my athlete's ability, I didn't want to take too many pain medication at the time. So I went through surgery, reconstructive surgery to repair the spine. And after a while, I got into the rehab program, which was pretty tough. At that time, it was almost unbearable for the pain. So I was introduced with painkillers. Not long after that, I had to take something to help with the inflammation, something to help with the muscle stiffness. And taking all those medication brought their load of side effects as well, which we had to try to control with some other medication like constipation, memory loss, concentration. And then after a while, it was more the sleeping issues. So then you introduce some more medication and so on and so on. At one point, I was taking about 15 to 16 different kind of medication per day, in which a few of them were like multiple times per day. So at one point, I would figure around 25 different pills every day on a daily basis. After a while, doing all those, I started to experience some long-term side effects like osteoporosis in my teeth, which my teeth were breaking all over the place, just eating cheddar cheese, for example. After a while, I also had some impaired testosterone function in my body, which I had to apply some creams or injections to control. So that added even more medication. after a while, I figured I have to find some other tricks to be able to manage the pain a bit better than taking all those medications. So I started to do some different kind of activities to keep the mind busy and try to take the pain off your mind for a little time. Doing so, I was able to reduce a bit of my medication, especially the in-between doses, to control the peak time of where the pain was unbearable. Um, After a while, I figured, well, okay, all those medication are giving me some short-term like little issues, but the long-term issues I was more concerned about. So I started to talk about it with my physician and starting to check if all those medications were still needed in my condition. A few of them I could probably start to reduce or completely remove. So I introduced myself with the pharmacist at first and trying to figure out a plan with the pharmacist on knowing which medication should I try to reduce at first, which would have the less complication, which would have the less withdrawal symptoms. And we came up with a plan that took me about 9 to 10 months to go over it. And today I'm able to say that I only take about 4 medications per day, including the testosterone one. That's not even to control the pain. It's more for the long-term side effects that I've been experiencing. Um, Going through a lot of that process, I've noticed that it's not an easy thing because you have your own objective, and sometimes the physician or the pharmacist have their own objectives as well, which is to reduce your pain and manage your health situation. So whether it's blood pressure issues or sugar level issues or pain issues, after a while you have to take some medication to try to get those under control, or at least you think it's the only way. But learning how to manage the pain and doing that for several years, I've noticed that sometimes pain isn't really that hard to manage if you keep your head busy. So I figured that doing some more activities around pleasure moments, that would be probably more benefit for me than taking medication. So I started to do a lot of things with the research, a lot of things with some other patients to try to help them out and try to figure out different solutions for myself and for others. So that's probably one of the main reasons why I'm here today and talking about my personal experience.
Thanks, Laurent. It's really helpful for you to share your story. And I think I just want to bring home that it's a very common story that patients can end up on multiple medications. And very commonly, as a doctor, I prescribe medications to treat side effects that patients are experiencing. And so that's how you can end up going from 5 to 15 medications. And that's one of the things we want to talk about today to see if we can avoid that. And that happens for all types of pain conditions and chronic conditions like diabetes and hypertension. So it's a pretty common problem that we face both as doctors and patients. So, we want to talk a little bit about the fuss around taking multiple medications. We know that medications are super helpful. They can be life-saving. People with transplants need them to keep their organ from being rejected. We need medications sometimes to control diabetes and blood pressure or to treat symptoms like pain and fever. And we know that, over the years, our life expectancy has increased. And part of that is because we've made some really incredible advances with medications. So we definitely don't want people to stop taking all of their medications after this talk. This is really more about how to initiate the discussion to see if maybe there's one or more medications that you could come down on the dose on or potentially stop, but you really want to do that in conversation with your healthcare provider, which I'm sure everyone on this webinar knows that. So I want to ask you a little bit to think about, what's a normal number of medications out there in the community. So if we think about people who are pretty healthy and they're living in the community, how many of them take 5 or more medications? Like, is that pretty common? So actually 65% of people over the age of 65 take 5 or more medications. So it's super common. But now we see that, a lot of older patients are taking 10 or more medications. And so that's actually even high at 25% of people. So 1 in 4 older adults are taking 10 or more medications. So we have seen this number go up over the years. And when we look at people who are even older, like 85 and older, the number taking 10 or more medications is 40%. So we know that as we get older, it's more common to take multiple medications. So you're not alone. If you're taking 10 medications, chances are someone else is also taking 10 medications, in your community or someone you work with or who you know. The fact is, over time, our medications need to change because we're changing. And so sometimes medications that we needed to take when we were younger, we don't need to take anymore. Or sometimes health conditions get better, or we treat them without medications, with diet and exercise. Our personal situation changes, and so do our needs and our priorities. And so the risks and benefits of some medications, what can happen is they can actually change over time. And so what we took when we were 40 might not be what we need to take when we're 50 or 60 or 80. Even though it is normal that we are taking more medications to manage more chronic conditions with time, sometimes we can also stop some of those medications because we don't need them anymore. So it's really something that shifts over time. Taking multiple medications, if they're not the best medication for you, or if something in your body changes, like your kidneys change or your liver changes, or you have a change in the amount of muscle you have, can mean that some medications over time can change and cause more risk than benefits. So sometimes a medication that you took for sleep previously, now that you take it, it can increase your risk of a fall or a fracture, or it can cause memory problems. Sometimes you get a new medication added, and it means the old one now will start to give you new side effects because they can interact. And it can even lead to hospitalization and some pretty serious consequences. So people who are most at risk, we sort of alluded to this, but that's people over the age of 65, because how you process medications changes as we get older. If you have multiple chronic health conditions, you could be at higher risk of having complications. Women often process medications differently than men, and so they could be at higher risk of complications. And we do know that medication side effects do lead to really important complications, like about 30% of hospitalizations. And some people have done research that shows that actually we could avoid these hospitalizations. And sometimes people end up in the hospital and it's not even recognized that it came as part of a side effect of their medication. I think, another important point to remember is that the more medications we take, it's very natural that there's a bigger chance that we might make mistakes when taking our medications and we might miss a really important one. I know that even when I have to take antibiotics twice a day, sometimes I'll forget to take one or two. So it can be really hard if you're taking 10 medications to remember to take them all. And so it's natural that you might miss doses. And some of those medications that we miss might be more important than others. And somebody put it in the chat already, but there's all types of medications that aren't prescribed necessarily. So sometimes our medications can interact with some natural health products, which, we might think are maybe safer because they're natural, but sometimes they actually can increase your risk of bleeding, or they can change how your body processes another medication. Traditional medicines can interact, and even just over-the-counter medications, so things like Tylenol or Advil, might interact with the medications that we're taking for our other conditions. So it's super important to speak to somebody like your pharmacist or your doctor to know a little bit more about how do these multiple medications interact, because a lot of them, when they were first studied, might have just been studied in someone without health problems, or they might have been studied in someone who was only taking a couple medications. And so when we're out there in the world with our own unique set of health conditions and our own unique set of medications, it can be really complicated. So it's really important that we start to have these discussions with someone who's really knowledgeable about the different types of interactions to see if we're on the best recipe of medications. So what can you do? Maybe you're a caregiver or a patient yourself or a healthcare professional. We want to ask today, how can we work together to prevent some of these harms from medications? Because that's so important that we're on the right combination for each of us. So there's this thing that you can do called deprescribing. It's a newer term. It's been around maybe for about 10 years now, or a little bit longer. But deprescribing, it means reducing or stopping medications. And that's, you're trying to stop or reduce medications that for you specifically might not be helping you, or they're no longer helping you, or they might be causing harm. And again, it's this idea that that can change over time. And so it's not to say that you were prescribed a medication in error. It's more to say that your needs might have changed as you got a new diagnosis or if a new medication was added. And so the goal of deprescribing is to maintain or improve your quality of life, but maybe decrease the number of pills that you have to take. So it's kind of cool. It's really a strategy, and it helps to prevent some of the harmful effects that can occur from taking multiple medications. Because ideally, we want you on the best combination of medications for your health so that you feel well and you get to do what you want to do in life and enjoy things. So we like to say that deprescribing is just part of good prescribing. So every medication has a kind of lifespan. Um, every medication we can talk over time to see if it needs to be continued or reassessed. And we think that, that should maybe happen once a year, but maybe more if you have a new condition or a new change in your life circumstances. Maybe if you move or if you get a new diagnosis, that's a really good time to reassess your medications and say, is everything I'm taking still needed? Or if you have a hospitalization or an emergency room visit, that's a really good time to say, like, let's take a look at my medications again, because maybe some new ones got added, or maybe there's a change in how my body handles these medications. And then that's a point where you could start deprescribing. So it's great if you can ask for somebody to review your medications, and that somebody can be a pharmacist or your nurse practitioner or your doctor. And so asking for a medication review, that's like a good term to remember and maybe write down, that can help identify some issues with your medications. And it is an opportunity for you to bring up whether or not you could be somebody who could undergo deprescribing. So those are like some two key terms to take away: medication review and can I get deprescribing? So there's lots of different ways where you can get a medication review, and it actually differs by province and by country. But some ways to do it is to book a special appointment because it does take time. And so if you kind of try to add it on at the end of your regular visit, there might not be enough time to really do it properly. So try and see if you can get a special appointment. It can be again with the community pharmacist, or the community pharmacist can help you get a list of your medications because it's really important when you go through this process that you have like a kind of accurate list of what you're actually taking and what you take it for. Before the visit, you might want to think about like, what do you want from your health and what are your life goals? Like, what do you want to achieve? Do you want to go on a cruise next summer? Do you want to be able to walk to the park, play with the grandkids? What are your goals? Do you want to live the longest possible? Do you want to live the best way possible for you? And ahead of time, you might want to write down some questions because maybe you've noticed some things about your medications that you want to address specifically. So here's where we get to the practical tool that we want to introduce to you. And so here today we have Carolyn Hoffman and Melissa Sheldrick from the Institute for Safe Medication Practices Canada. And Carolyn's a registered nurse with training in nursing and safety. And she's also the chief executive officer of the Institute. And she has so much experience in improving medication safety across healthcare settings that we're very lucky to have her today. And similarly, Melissa Sheldrick is someone who offers a really unique perspective as a patient and family advisor with the Institute. And she's an educator. So she's a teacher and she's been working with families for more than 25 years. And Melissa has been advocating for safety after the loss of her 8-year-old son, Andrew, due to a preventable medication error. So a very personal experience. And today they're going to walk us through a simple but pretty powerful tool that's going to help you as a patient or caregiver have a more confident, informed conversation about, a medication review with your healthcare providers. So I'm going to turn things over to them now.
Thank you, Emily, and all involved in the webinar today for coming together to learn about the risks of multiple medications and to take action to address them. We are pleased to be part of this very important discussion and action plan. I'll begin by sharing a little bit about ISMP Canada to make sure all our participants are aware that we are a national, independent, not-for-profit organization that purposefully partners with consumers, healthcare providers, healthcare organizations, anyone that wants to strengthen medication safety through timely learning, sharing, and acting. And you see our cycle here: learn, share, and act. We learn by collecting and analyzing reports about medication errors from consumers, healthcare providers, caregivers, and others. And many participants may not be aware of that. We need to know from you what things are going wrong with your medications. Please pop in the chat and let us know if you'd be interested in the web links for reporting. We use this knowledge to understand what issues and errors are occurring with medications and why, and then we develop and share lessons learned with evidence-informed recommendations for reducing preventable harm related to those errors. ISMP Canada then purposely partners with all of those individuals and groups to implement, sustain, and evaluate the actions taken. This is how we learned about the importance of partnering and co-designing medication safety tools for patients and caregivers, starting with 5 questions to ask about my medications in 2016. And here on this slide, we see the 5 questions to ask launched in 2016 that were designed to help caregivers, patients, and providers to actually talk about their medications with meaningful questions. The first 5 questions to ask has 5 simple and empowering questions. They are designed to open the dialogue that will reduce the risk of errors and adverse reactions. Initially and over many years, the strongest advocate for this tool was Judith Maxwell. She is pictured here proudly wearing her 5 questions to ask t-shirt. Judith endured 7 years of undiagnosed serious health problems, only to find out in the end that they were adverse drug reactions due to multiple medications. The reactions resulted in many specialist referrals, tests, and hospitalizations. Her life was significantly impacted. Eventually, with her striving and looking for answers and trying to move forward and see what was causing this impact on her life, eventually, with the help of her pharmacist and cardiologist, it was confirmed that her issues and symptoms may have been caused by some of her medications that she was taking. Over time, her medications were slowly reduced to a minimum, and she began to regain the lifestyle she loved. Judith learned and shared how important it was to talk with healthcare providers about your medications. She has since passed away, as you can see, in January of 2024. She was an incredible champion for medication safety. Her story is shared with permission from her family in the new tools developed for patients taking multiple medications. On the next slide, we see that the goals for this new tool. Last year, ISMP Canada received funding from Canada's Drug Agency to lead, along with collaborating with many organizations across Canada and patients and caregivers, to lead the collaborative development of the new 5 questions to ask tool about multiple medications and the toolkit that goes with it. You can see the goals here. It's about helping to have patients, their caregivers, have a tool that is going to enable decisions together with their doctor, nurse practitioner, or pharmacist. It's going to determine and be a tool for helping to know what is working well for them and what might need attention, what needs to be looked at, and a tool for the patients and caregivers to be more involved in decisions about their health and staying safe with multiple medications. To learn more about the tool and the toolkit, over to Melissa.
Thanks, Carolyn. Good afternoon, everybody. Good morning. So to develop this resource or tool, we followed quite a systematic process. We started by looking at the research to learn about the current information that supports increasing the awareness of the use of multiple medications, to learn about patients' preferences and perceptions. And we also looked at the tools that are already out there for people who are taking multiple medications. And so once we looked at that research, we presented a summary of the themes to patients and caregivers and also health system partners. And we did that through 3 roundtable discussions, so live discussions about their thoughts and ideas. And the feedback that we received was incorporated into the development of this tool directly. It was an important part of the process to balance the findings from the research with the feedback from people with a direct lived experience. That was a very, very important component for us to consider. And so refining the questions that best reflected what we heard and what we learned really gave us an opportunity to consider the most effective questions to give patients a launch pad for their conversations with their healthcare providers. And so, building off the tremendous uptake of our previous 5 questions to ask tools, these questions about my multiple medications can help patients reflect on or actually ask their provider whether their medications are working well or not. We want people to be better equipped to actively partner in making decisions about their medications, and this tool provides a starting point for these key discussions. We also created a toolkit to help patients and families find more information related to taking multiple medications. So let's dig into that toolkit and look at each question a little bit more. We wanted to provide a space where people could find practical tips and some additional resources. We felt it was important to create this toolkit in order to support patients and caregivers who really wanted to learn more about why these questions are key to safer use of multiple medications. You'll find some statistics, you'll find more about Judith's story, and some additional link to some helpful resources. So in the toolkit, every question has its own page, and there are 3 sections to each one: the question itself, some additional information, and a safety tip. The light bulb icon that you see indicates that this is a tip or a reminder or a key piece of information that you can hold on to as you work with your prescriber and make decisions together about your multiple medications. So let's take a deeper dive into each question. And this first question is, what is the purpose of each of my medications? Knowing why you take a particular medication is an important piece of safety. It could be as simple as, this medication is for my cholesterol, or this one lowers my blood sugar. Consider this scenario. You change prescribers, or you're in the hospital and the new prescriber offers a medication with a different name. And when you ask what it's for, it could be a duplicate of something you are already taking. You have a very important role in preventing errors. Question 2 is, could I be experiencing any side effects or drug interactions? It's possible that your medications could cause an unintended side effect or could interact with the medication. Perhaps you are noticing something new since you began taking multiple medications. Asking this question can help start a conversation with your prescriber or pharmacist about the possibility that the multiple medications could be at the root of it. And this safety tip beside the light bulb is really important. Call your doctor, your nurse practitioner, or your pharmacist before making any changes to your medications, even if you have been taking them for a long time. It's important for you to have all of the information you need, and it's important for them to know how you are taking your medications. Question 3 is around lifestyle. Could lifestyle changes also improve my well-being? And this question has to do with the things that patients can also do to improve their health or maintain their health alongside their medications. For example, keeping a sleep diary and setting an alarm for regular sleep time can help patients develop a better routine that can improve their sleep hygiene. And this may be helpful to reduce or eliminate the need for a sleeping pill, which can lead to an increased risk of falls. This question asks, are all my medications needed? You may find that you have been taking the same medications for a long time and you wonder if they're still needed. What a great question. Your prescriber is best suited to talk with you about this, and together you can review why you are taking it, if lifestyle changes could affect it, or by evaluating if your health has changed in any way. This really leads to meaningful discussions and makes decisions together about your multiple medications. And finally, The last question is, what other information should I know about my medications? Well, sometimes there are other pieces of information that are pertinent, but may not be part of an initial discussion with your healthcare providers. And asking this particular question might give an opportunity to open up that conversation. It could be any number of topics, from managing your routines to patient programs that are offered. It's worth seeing if there is anything else you should know. So we have another poll for all of you. So if we can go ahead and launch that now. We would like to know from you, how useful do you think this tool could be for you or someone you know? And how could you use this tool? So there's two questions there, and we would invite you to answer these questions. And then the third question is only if you answer other to question two. There's a free text box there. We'll just give you a minute to put your answers in. How useful is this tool? Is it very useful, somewhat useful, all the way down? And then how could you use the tool? Let us know. Can you bring it to your health appointment for yourself or someone that you are supporting? You can talk to people around, you can talk about it with the people around you, you can share it with others, and then any other ideas, we would love to hear from you. And we'll just give a few more seconds. Okay, so thank you for sharing those results. So pleased to see that the majority of people think that this is a very useful tool. We hope that you will be able to take it with you and use it. And then for question two, how could you use this tool? Yes, many people saying that it's such a great resource to take with you directly to your health appointment, talking to the people around you, because you are likely not the only one taking multiple medications, sharing it with others so people have access to it. And then later on, we'll be able to see what folks wrote in the free text box. So I just want to take a moment to thank you for contributing and sharing your ideas, and I'll turn it back to Emily.
Thanks, Melissa. Thanks, Carolyn. Okay, I want to dive right in now to a conversation with Laurent, because I see there's some really important questions in the chat about, what if the doctor isn't hearing me? How do I actually have this sensitive discussion? So I want to get Laurent's take on this. Laurent, you didn't have access to any tool like this when you started having these conversations with your healthcare providers. So very honestly, I would personally just like to hear your comments on the tool and what your first thoughts are.
Well, obviously, that would have been a tool that would have been really practical back in the day. There's a few things in there that I actually went through the same kind of questions to myself, but not as organized as this one. So having that organized would have been a lot easier to do some research on my end and have some conversation with the healthcare provider as well.
I'm just wondering, you said that you asked, some similar questions as the one on this tool. Can you tell us some examples of exactly which questions you sort of asked and how that helped you?
Yeah, of course. Like on the first question, what's the purpose of all the medication?
Right.
As one example, I was taking at one point some medication for depression, but that was actually helping for the pain management. And so the first thing I did is going back to the pharmacy, and where they leave the instruction, like take this medication twice a day and this and that. And most of the time, I asked the pharmacist to put in there as well the reason why I take every medication on my list. So that way, if ever I forget or if ever somebody else consults my medication list, they know exactly why I'm taking every kind of medication I'm taking.
Okay, and what about question two? I feel like when we've spoken in the past, you asked a bit about whether or not your side effects could be from medications or interactions. Did that come up?
Obviously, it did. At first they tell you only about the short-term side effects that you could experience, like constipation or memory loss, or and some kind of impairment, but not normally. It's kind of mild and it goes away after 2-3 months or so. But there's some other side effects which they don't really talk to you about. Like some medications have like 5 pages of side effects potentially. So just being aware of every kind of side effect that every medication you take could have on your body, that's a good thing to know. So what I did is I went back to the pharmacy, asked them to give me a file on every medication I'm taking with every kind of possible side effects that I could be experiencing with those. And if ever there was some interactions with some other medications as well, to be aware of it. So being aware of all the side effects that could potentially happen while I'm taking all those medication was a lot easier for me back then to be able to identify, okay, this side effect, it's not cool. So is it because of one of my medication or is it because of something else? So being aware of what could potentially be caused by medication, it's easier to narrow down and see exactly why I'm experiencing those things and being able to take action on it.
Is it fair to say that knowing the side effects helped you make a more informed decision about whether or not you wanted to continue or potentially stop some of the medications?
Absolutely. That was the one of the main reasons was knowing the side effects. Because at one point, being able to handle pain a bit better was one thing, but your quality of life becomes a bit more important as you live. So after a while, pain was being a bit more manageable. So I figured, okay, I got to take hands-on anything that could help me with my quality of life. So having less constipation, having less blurry mind, being able to sleep better, and all those little things that impacts your everyday routine sometimes has a bit more of an impact than dealing with the pain itself.
Right. I hear this a lot when I give this talk, but a lot of patients and myself included, I'm maybe nervous to speak to my doctor, or you might be nervous to bring this up because in a way it's sort of maybe challenging their authority or their knowledge. Did that happen to you? How do you deal with that? Like, how do you get past the ego of the person prescribing to you?
Actually, my main take on that would be that these healthcare providers, they're professional in health in general, right? But as a patient, you're professional in your own condition. So your knowledge about yourself, how you feel, how you experience your everyday routine, and how you experience the taking the medication and all those side effects, the physician is not always aware of all that.
Right.
So being able to have an honest conversation, like in the mid-30s, when you're not able to have a I don't know, like a good sexual relationship because medication is affecting your manhood in a certain way that you ain't, if you're not even able to have sex no more. But talking about that with your physician, he gets to understand, okay, your pain is maybe less important than your sex life, for example. So just being able to address those kind of situations makes the healthcare provider more aware of your situation and more aware of what's your priorities. Maybe for now, your sex life is more important than managing your pain. As for somebody else, could be like, for example, pregnancy or
Yeah.
I'm not working anymore, so I don't need as much concentration. I don't need to sleep as much because I don't work no more. So depending on what you're living in your personal life, it has an effect on what kind of medication you should be using. So
Yeah.
being able to address that with your physician or your pharmacist should be pretty honest. You don't need to hide anything in there.
Yeah, it's a really good example that you give. Another example that patients have brought up to me is that they're having trouble sleeping, but it's also very important for them to maintain their balance, like their physical balance, and also the ability to drive. And so when I talk to them about sleeping pills, I'll say, okay, we have a pill that can help you with your sleep, but you should know that it's probably not safe to drive in the morning, and that also it increases your risk of fall and hip fracture. And so that allows the patient to make a more informed decision. Sometimes what's happening is somebody says, I have trouble sleeping, and then a sleeping pill gets prescribed. But it's really important for people to say some of the other important things in my life on top of sleep is my balance and my autonomy and my ability to drive. And then you can have a more informed discussion about the medication and whether you want to take it or not. To end the discussion, I just want to ask you, where do you think we should take it from here? Like more specifically, who do you think is going to benefit the most from this tool that we presented today?
I would say probably any patient that is able to take the things hands-on. If you just put yourself out there in the hands of the physician, they're going to be able to, resolve most of your health issues, but they're not able to take the other things hands-on. So being able to take control over your patient's life, it's a good thing. So being in control is empowering. And being able to discuss with the doctors, they say, okay, well, I maybe need something to help me sleep, but I don't want it to impair my driving abilities. I don't want it to be, I want to be able to wake up when the kids are waking up in the morning, or, if there's a baby crying overnight, I want to be able to be aware and be there if needed. So being able to get the right kind of drug for the right kind of condition, sometimes it's empowering for the patient as well. And to be able to tell, okay, well, I won't take this one because of that reason, but if you prescribe me this one, that will do it. So being able to have that kind of discussion is empowering for the patient, and most of the time he's going to be more inclined to use the medication because it's more suited to him.
Yeah, very, very insightful. Well said. I really appreciate you sharing your story and helping us get the word out there. We're going to move on to the question period. So if you want to put your question in the chat, we are happy to answer them collectively as a group. I'm just reading some of the comments in the chat here. And people are actually chatting back and forth with each other as well, giving each other shared resources, which is amazing. Heather brings up that we're all individuals, and so too are the effects of medications, and pain can affect others differently. And so, how you experience pain or how you experience fatigue, of course, differs from person to person. And that's a healthcare provider, it's important that I ask about that. And it's also important that as a patient, you mention what your experience is with your side effect, because that really helps me to make a more informed decision about what I think is a good prescription for you. I like this question here. What are the 5 most important meds to reassess in older adults? So I would say that medications that affect memory and balance are really important to assess in older adults. So that could be things like pain medications can affect your memory and your balance. Also, medications for sleep, those can affect your memory and your balance. Bladder medications can affect your memory and your balance. And then there are also some medications that people take for a long time that they just might not need anymore that can increase to their pill burden. So medications to treat acid reflux, those are really common. I see about half of my patients taking them. They're maybe for the most part intended to be taken for a few weeks to a couple months, but sometimes people end up taking them for many years. So a class of medication called proton pump inhibitors. And there are others, of course, but blood thinners are something to think about because you're more likely to bleed as you get older or if you fall. So that could be something to discuss. Um, let's see if we can take another question here. Yeah, Kathleen wants to know if patients are asking if there are more natural ways of doing things instead of taking another medication. I highly encourage this. I think that, if you can access something like physiotherapy or an osteopath or an exercise program, that these are really interesting alternatives or else complementary to medication so that you could take lower doses of them potentially if you have challenges with pain, back pain, hip pain. sleep, sometimes exercise can help all of those things together. And so, asking if there's the possibility of being referred to some complementary therapy can maybe avoid some of those medications or help us reduce those medications. I see Patricia's also entered in blood pressure medications, which is a really good one to reassess because those could increase the risk of falls and your blood pressure can change over time. So, we really want you to help us spread the word and share the 5 questions to ask toolkit. Tell your community about it. We want to hear about your experiences using it. So, tag us in a photo on social media or email us and just let us know if you're using it and how you used it. That would be fantastic. Also, for you to stay connected. If you're not sure where or how to start a medication review, remember I said that's a key term to remember. We actually have set up a service to help you see where in Canada, based on where you live, you can get a medication review. And again, there's different healthcare providers that do this. So some places it's pharmacists, some places it's doctors. In some places, it depends the number of medications you're taking or the types. And so that's, too much information for one person to find on their own. So we put it all together here for you. So you can either get that link or click on the QR code, or we're going to share this with you afterwards. So you don't have to stress if you don't pick it up now. We'll send you the link for how to find where to do a med review, which is, one of the first really important steps. And then another tool that I wanted to give you all access to is MedSafer. So this is the link here and also the QR code. And what MedSafer does is it helps you ahead of time get ready for your medication review. So you type in your medications and it asks you a few questions about your health conditions, and then it will actually set up the med review for your healthcare provider. So your doctor or your pharmacist could log into the system and they can see 2 or 3 medications that might be eligible for deprescribing. So like it gets the conversation started, and it's a really nice tool that was developed by our network and supported by Canada's Drug Agency. We have lots of resources available on our website here that have been translated into different languages, and it's so important when you're having this conversation that you do try and have it in the person's first language because it is a really complex topic. And of course, discussing people's values and their desires for their health, having that conversation or initiating that conversation in the language that they're most comfortable with is really, really helpful and important. So we do hope that you can help us again by answering this final survey to let us know about the presentation, because we do hope to give it again in the future, and we can absolutely update it or add more or less information. So if you have time and you want to give us some feedback to help us improve the seminar for the future, we would be so grateful. So yeah, thank you again, everyone, for joining today. And we hope you found it helpful. And thank you to Canada's Drug Agency for making this type of presentation possible and for really moving the agenda forward in Canada as it relates to medication safety and appropriate use. Take care.